Okay. Thank you very much for all of our participants who have joined us live at this very sunny day and nearly beginning of summer. This is the first session of our spring series. Anya, unfortunately, is not able to join us for this week because she is in a workshop in London. But we will, with the participation of presentation of Jessica, I think we will do an excellent start to our spring sessions, and then we will continue with two other sessions on recruitment of part on the use of social media tools for the research purposes. So today Jessica is with us. Jessica will be presenting her research in which she used Facebook recruitment in Senegal. And I'm looking forward to this presentation. It will take around 40 minutes, and then we will have a Q&A session in which you can ask your questions to Jessica. Yeah, this will be recorded, and we will also upload the recording to YouTube in case you miss some parts of this presentation. Okay, Jessica, thank you very much again for joining us. The floor is yours. You can just go ahead and start your presentation.
Okay, perfect. Thank you so much. So, yeah, my name's Jessica Donsova. I'm a doctoral researcher at the Max Planck Institute for Demographic Research and at Bielefeld University. And this data collection in Senegal is one of my dissertation projects. And the way I have structured this talk is that I will at first tell you a little bit about what motivates this project, then give you an overview of the data collection, how it was set up, the campaign design, and then present two research papers that will come out of this project. And this is still work in progress, but I have some results to show you. So the first project one is more a survey methods project together with colleagues at the GESIS Institute, Björn Rohr and Steffen Pötzke. And we are looking at the response quality in the different regions of Senegal. And the second project is more a demographic application where we try to estimate fertility with the network reporting that I will explain in the talk and compare to data from the Demographic Health Survey. And this is a joint project with my PhD supervisors here at Max Planck, Daniela Perotta and Emilio Zagini, and Dennis Fian at Berkeley. So the motivation for this project is that there is a lack of vital registration data in many parts of the world, especially sub-Saharan Africa. So a lot of births, for example, go unregistered, but those data are vital if you want to monitor population development and implement health policies. However, this registration is also slow to expand. So instead of this data, there's often the dependence on large-scale surveys. For example, the Demographic Health Survey is like a prominent example of that. However, they are also costly and infrequent, or for the case of the Demographic Health Survey at the moment, discontinued because it was defunded after the new US administration defunded the US aid program. So there are a few alternative or new data collection approaches, including digital solutions. For the past decade, social media-based surveys have been increasingly explored for data collection as they are often more cost efficient and faster. However, they of course face many quality challenges. We know already a few things about using Facebook as a recruitment tool in sub-Saharan Africa. For the use of this platform, we know from previous research that there is a gender gap with higher user rates for men. For survey recruitment, so previous studies that have used this recruitment approach in sub-Saharan Africa have largely found an overrepresentation of men, a more urban and a more educated population compared to offline surveys. And we also know that the regional coverage varies with higher participation from urban users than those from rural parts of the country, also depending on internet connection. And regarding this coverage issue, I will come back to this in the second project where we used our network reporting approach and wanted to explore whether this can help mitigate some of this representation and coverage. So in our project, we did a data collection using paid advertisements on Facebook and only Facebook, not Instagram. In Senegal, we wanted to recruit the general online or Facebook population in Senegal, and the substantive interest of our online survey was the number of children of the respondents and of members of their social network. And we are using data from the 2023 Demographic Health Survey in Senegal as a comparison data. Before we launched our survey, we conducted a small number of pre-tests, exploring different campaign designs. For example, we tested in the capital whether mentioning an incentive versus not mentioning an incentive improves our participation rate, and our incentive was a lottery for a mobile phone credit. So this is what we did in a 4-day data collection in two campaigns that ran in parallel, with one mentioning an incentive in the ad and the other one not. And what this showed us was that for our costs and our number per completed interview, the incentive campaign seems to be working better and seems to be favorable. So there are no too large differences in terms of impression and reach or link clicks. However, the recruitment into our survey was more efficient for those campaigns or with those ads that mentioned a lottery for mobile phone credit in the ad text. So this is why for the final data collection, we decided to continue with giving an incentive, and we have also redesigned this somewhat to also not only mention the incentive in the ad text, but also on the image. So this final data collection ran in October 2024. So our comparison data with the DHS 2023 is like a 1-year gap between the two. We used a traffic campaign, so we did not use any additional tracking using Metapixel or anything like that, and we optimized our campaign for link clicks. The ad sets were stratified by region and by gender. So the 14 regions in Senegal, which is like the federal state level. And where possible, I also stratified the advertisement sets by age, and I will show you this in a second. As I said, there was a lottery for mobile phone credit, and this was set up in a separate survey. So we had our main survey that was anonymous, and then once people completed, they could transfer into the second survey, provided their consent for giving their mobile phone numbers, and then afterwards I did a random draw of those mobile phone numbers and did the transfer to the lottery winners, which we also announced on our Facebook page, and we got some positive replies. So this whole transfer with an extra company also worked and reached the participants. Yeah, and overall, 833 people started to respond with a cost then of about €5.50 per started interview. As I said, I couldn't target by age in every region. So here you see Senegal with its 14 regions. The capital is Dakar. And for initially, I wanted to stratify my advertisement sets by 3 age groups, but then for women, largely this was not possible because the user counts were just too small, and I kept receiving warnings that there would be too few users in my advertisement sets if you separate by age groups. So for women, I was only able to target by age in the capital and in the neighboring region for 3 age groups. until the age of 29, 41, and then until 49. This on the upper bound of the ages corresponds to the sampling ages of the DHS, which is why we put the cutoff there. And for two age groups in the neighboring region. For men, there are more male Facebook users than female Facebook users in Senegal. So this made it possible to target or to stratify by age for more regions, which I then also did to, yeah, as much as possible, make sure that that's get distributed more equally by age group. This is what we received in campaign performance. So overall, the estimated audience size is about 3 million people in Senegal at the time in October 2024 of our data collection. We reached about 1 million of them and then had about 70,000 link clicks on our ads. This resulted finally in 2,000 people that went beyond our welcome page and 830 respondents that started to respond. And I had measured this as they at least answered one question on the first 4 survey pages. Because on survey page 4, there was a compulsory question. So if they did not answer that one, they would have been dropped. So they at least started to respond to the beginning of the survey. Overall, the cost per click are quite cheap, I would say, with 5 cents. And they range between 2 in the capital and the maximum of 14 cents in regions with fewer Facebook users. Looking in more detail at the cost, so here you can see the cost per link click for all regions and how the Facebook users are distributed within the country. So this is the about 3 million Facebook users as of October 2024. And we can see that 52% of them are in the capital, 12% are in the neighboring region. So the majority is situated on the west coast of the country. And then the remaining regions have lower percentages of Facebook users. And this is also reflected in the cost per link click. So the cheapest cost per link click is in the regions that have higher user counts, and then the highest cost with 14 cents is also in a region where only 1.3% of the Facebook users are. What we also looked at was in our campaign data, what kind of device people use to fill out the survey. This was relevant for our response quality paper, where we also looked at things like item non-response. So we wanted to see whether things like if people used a desktop or a smartphone would have an effect on like things like item non-response depending on the screen size. However, basically everyone who clicked on our ads, so this is the metadata, uses a smartphone, so predominantly an Android smartphone, regardless of the region, and if not an Android, then an iPhone. So it seems like for those who clicked on our ads, desktop use is not really relevant. So data collections should also in Senegal optimize for display on mobile phones and set the survey up to be filled out on a mobile phone. And finally, for the campaign data, we also checked how much where Meta thinks the people are corresponds to where they say themselves that they are situated. So in the seed map, you can see the ad set region where the people were targeted. So where Facebook thinks that they are located versus where they self-reported in our survey where they are located. So we can see that for Dakar, 80% of those who were targeted in Dakar also said that they are in Dakar. And in that diagonal, so to speak, the correct regional classification. And this varies quite a bit. So while we have 80% or 86% for some regions, we also have lower accuracy for some other regions. And even for one region, we have no correspondence at all. And interestingly, we have like a second pattern where where Meta thought they were in some other region, but they self-reported that they're actually in the capital. And for some of these, the correspondence is quite high, but when you compare to the map, they are not like 35%, for example. They are not even neighboring regions, so they are quite far apart actually. I know from data collections in Europe or North America that this regional targeting is usually more accurate, but here it seems to vary quite a bit by a subnational region, which underlines that it's important to also always ask the information that you're targeting about to check whether this is actually accurate. So this is just some descriptives of our sample composition. So we have more men than women in our sample. We have predominantly people aged 18 to 29. We still have 31% that have a tertiary education, more urban than rural respondents. And interestingly, we have 12% of respondents that said that they're not religious or have another than Muslim religion, which is more than in the general population because Senegal is a predominantly Muslim country. So much about the data itself and the data collection. And now I want to present some results from the project that I'm doing together with the colleagues at GESIS. And here we look at 3 error sources. At first, we look at who is starting the survey. And there we had two assumptions. So based on research regarding the digital gender gap, we assumed that men would have a higher starting rate compared to women. And we also assumed that it would be a higher starting rate in the capital compared to non-capital regions. So we always do the separation between capital and non-capital here. And as you saw on the map, we have 54% of the users in the capital versus the rest of the country. So based on this distribution, we made the separation between capital and non-capital here. Second, we look at dropout, and this is over the survey pages. So we look page by page, whether the bias in the demographic composition compared to our benchmark data, the demographic health survey, increases over the course of the survey. And finally, we look at item non-response. And here we assumed that it would be higher for those in the non-capital regions. And we based these assumptions on potential weaker internet connection or higher cost for entering an online survey, higher internet connection cost. So starting with the first results for the starting error, what we did here is we used the information in the ad set. So for every person or for every advertisement through URL parameters, I also collected in Lime survey on which ad set they clicked. So I know for every person who clicked which ad they saw. That means which region, which gender, if there was age targeting, which age, or which image this was. So this is the targeting, the ad set gender, and then I distinguished those that only clicked. That means that had like a unit non-response, did not fill out anything, versus those respondents, those 830 that started to respond. And basically what we can see here is that there is no big difference between the ad set genders. So among those who clicked, we have 60% men and 40% women, and above in those who responded, it's like a 1% difference, but this is not like a significant difference. So there seems to be no gender. The ad composition does not seem to be different between those who only clicked, and those who started to respond. However, if we look by region, we actually see a bigger difference for the capital, which is the opposite direction of what we assumed. Among those who only clicked on the survey and did not respond to anything, we have 29% targeted in the capital, and among the those who actually started to respond, we have only 15%, so fewer respondents from the capital. That means like a lower starting rate from the capital, which is the opposite of what we thought with our assumption about internet connection or higher internet costs. We can speculate. We don't really know yet how to interpret this, but maybe this is more related to a higher commitment in maybe if you have a weaker internet connection or higher costs, and then you decide to actually click, maybe you're more committed and then actually go through with the survey. Whether maybe in the capital it's more of like, oh, I'm going to check whether I find this interesting, and then I don't, and then I drop out again. But this is only speculating at this point. Next, we compare our data to the demographic health survey. So what you see here is one for the non-capital regions and one for the capital regions, our survey in reference to the non-capital or capital regions of the demographic health survey, so the representative benchmark data. And how this is read is basically that in the non-capital regions, we have more men in our survey than in the DHS and fewer women. Or we have no gender difference between our survey and the demographic health survey. And the different pages, with the different pages, what I aim to measure is the dropout throughout the survey. So on page 1, we have everyone. And on page 9, we only have those that completed the survey. And then going through the pages, on page 2, we are losing those that have dropped out of page 1 and at page 1 and so on. And what we can see here is, for example, that at the beginning in the non-capital regions, we don't have an age bias. However, going through with the survey, at the end, those who completed are starting to become, our sample is starting to become biased by age, and they are starting to become younger than the estimates from the demographic health survey. The same with the education. So while overall our sample is more tertiary educated than what the DHS estimates, this increases over the course of the survey. So the education bias increases. And while our sample is also more urban, this stays constant over the survey. For the non-capital regions and for the capital regions, we find fewer bias or no bias for gender and age, and also slightly increase or variation for the education over the course of the survey. But overall, this stays more constant over the survey pages, so people don't drop out that systematically as in the non-capital regions. And finally, for this project, I calculated the item non-response and this is just for the beginning, so the first 3 pages of the survey. Again, for the 2 regions. I think overall, this item non-response seems quite high to me compared to other online surveys. So we always have at least 40% of those who saw the question but did not answer. And opposite to what we expected, this is higher for the capital regions in blue than for the non-capital regions. So maybe this again goes a little bit similar to the explanation for the starting bias, that people in the non-capital regions are maybe more committed, more selective. But I think this needs to be further investigated also by age and gender pattern, because I would assume that they also differ systematically depending on the region, and also might impact item non-response patterns. So in the next steps, I want to look more at this separated by age groups and by gender, and maybe by education. So this was the first project, and now I'm moving to the second project with my colleagues here at MPIDR, and I will tell you about the second part in our survey about our network reporting. So basically what network reporting is, it's a tool to reach hard-to-survey populations. And the basic idea is that you don't ask people only about information about themselves, but also about members of their social network. So this like indirect information. And it has been used previously in demographic research to calculate mortality rates. It also has been used previously by my co-author in connection with Facebook surveys to calculate internet adoption rates. And what we are asking now is, since we know that there is an undercoverage of large parts of the population in Senegal, if we only sample through Facebook, we are wondering whether extending to this network part can help us to expand and reduce some of this undercoverage bias. So this is how it was implemented in our survey. So basically, we have the beginning where we ask people the socio-demographic information. That's the one you just saw. We ask them about the number of children, and then we assign them to one of two network definitions that have been explored in a previous research. So one is people with whom they had a conversation the previous day, and the other one is people with whom they shared a meal the previous day. And then they are basically asked, so think about the first person you had a conversation with. What's the gender of this person? What's the age of this person? How many children does this person have? And so on. And then we do this for up to 3 contacts. And since this is getting quite tedious, we have an attention check after the second contact, which I'm not showing here, but everyone passed actually. So I think my attention check was too easy because I was just asking for the capital of Senegal and everyone got that. So I think maybe should have used a more complicated attention check. So now switching from only respondents to our network data set, this is what it looks like. So we have 244 respondents, the people that clicked on our ad and filled out the survey, and also so this is now cleaned from our 830, cleaned to the ones that provided sufficient information for in the network part. Then they provided information for up to 3 members of their network. That's 482. And then for each of these people, they were asked how many children this person has. So this is information 800, about 880 reported children information, so to speak, at various ages. So for example, if I had a conversation with my grandma the previous day, and like she's 80 and then she obviously will have a grown-up child. So then I would say yes, 1 child, and this child is 50 or something. So, and then going back with this information, we calculate the year in which this person must have been born and the age of the network member that they had during that year. Now this is the similar plot to the ones with the pages I have just shown you, but now in orange I'm also adding how our network member composition compares to the demographic health survey. And what we see is that we find fewer or smaller gender bias for our network members, and while our respondents, we already know, are more higher educated than the demographic health survey, our network respondents still are, but they're getting a little bit closer to what the DHS is estimating. So in terms of gender and education, we find that the information we have about our network members is getting somewhat closer to the benchmark data of the demographic health survey. When we look in more detail at the composition, so purple are our Facebook respondents, network members are orange, and green is the benchmark data. We see that for women, we oversample for both the network and the respondents, we oversample younger women. For men, the estimates are closer together. What we get additionally for the network members is also information about people below 18, because on Facebook we only targeted starting 18 plus, but if people had contact with, let's say, their own children or younger relatives, we now have also some additional information for those. For women, our respondents, so looking at the number of children from no to more than 7, our respondents and network members are more childless than the DHS and have a higher percentage of those with a lower number of children. For men, it's actually the opposite, so they are less childless and have more 1 to 3 children. Although we can see that the general shape sort of corresponds with the DHS. And then looking at the thing about the Facebook use. So we asked the network members, the respondents, does this person use Facebook? Because for our respondents, of course, this is 100%. They were targeted to Facebook. And for their network members, 21% of the men and 18% of the women do not use Facebook. So we still also among the network members have a big, the majority of them use Facebook themselves. But like this, about 20% is like the additional coverage that we get through our network reporting. So those people we never would have been able to target because they are not on the platform. There's not really like comparison data, whether this is a big or a small proportion. I would say that it's quite good, assuming that you always report about people who are similar to yourself in terms of age and gender. So you could have also have assumed that they also use Facebook, but I think getting like 20% additional is it's quite a good result. And yeah, finally, I have a first attempt at calculating age-specific fertility rates with our network information. So what you can see here is the age group. This is for women, so you can see 15 until 49, which are the reproductive ages. You see the rate per 100 number of children per 100 women, and this is pooled for the years 2018 until 2023, because this is also where for these years the DHS also has pooled estimates, and we decided to pool them because of case number regions. Previously, I had them by year, but this was getting quite more noisy, and the case numbers were too small, so we decided to pool them together. So what we can see is that our estimates in blue do underestimate the fertility in comparison to what the DHS estimates. We have, I think this is some data noise at the end. But what we also see is that the shape is sort of similar. So we have an increase in the early ages, we have a maximum, and we have a decrease going starting from the ages of 30. And this is still unweighted. So we still have a more higher educated and a more urban population. So I would assume that once we start to compute weights and adjust for that, we can get a little bit closer to what the Demographic Health Survey also estimates. And I think what the application for this could be, even if we don't get to exact the estimate, if we can also for other years see that maybe the overall schedule of the fertility holds, this could be a useful application for trend analysis or for identifying crisis or shocks to the fertility rates in a country. So yeah, finally, what I've learned so far from this data collection is that, in my opinion, the incentives mattered and are quite important. So for data collection in contexts where internet is expensive, I would always recommend to try to compensate the respondents for that. We find that the regional targeting accuracy varies by subnational region quite a bit. There's been some research that suggests that the targeting algorithm has been trained on European data, which might explain why outside of Europe it might be a little bit less accurate. I think this could be one explanation why we find like a lower match between our regions, the self-reported regions and the targeted regions. For the response quality, our assumptions with the better quality in the capital regions did not hold for the starting and the item done response. So yeah, we need to explore further what potential explanations for this could be. In terms of our composition we find similar overrepresentation of men, tertiary educated and urban population as previous studies have done. But we do find some benefit for our network samples that in some demographics, they are less biased. And while we still underestimate the fertility with the unweighted estimates, I think this can be useful in the future if we do some further weighting and modeling to potentially identify some trends or shocks to fertility. Yeah, and with that was all for me so far. And I'm looking forward to your questions.
Jessica, thank you very much. This was a really interesting presentation, and I have seen many results that I wouldn't expect to see. So in that regard, for me, it has been really informative as well. Okay, so feel free to ask your questions, dear participants. You can ask your questions through the Q&A functionality, and if you like, I can also let you talk. So Aaron, I have seen that you have raised your hand. So if you want to ask your question with your microphone, I will just let you talk.
Thanks, Ekut. Thanks very much, Jessica, for the presentation. It was super well done. We have a similar project in Nigeria where we have very similar findings. So it's published in Sociological Methods and Research, if you haven't seen it. My question is about language, actually. So I was just curious. I just looked it up. I mean, French is the only official language in Senegal, but at least from what I saw, only about a quarter of the population speaks French, and that's probably highly correlated with demographic characteristics. Did you do the survey in Wolof as well? Is the first question. And then the second part of the question is, yeah, so we had a huge problem in Nigeria. I mean, Nigeria, the estimates are, among women, I think it's more than a third of the population is illiterate. When you do that network approach, do you ask anything about the literacy of the other people? Because my sense is it's not that if people are on Facebook or not, that's the problem. It's actually whether they're literate at all or not. So they wouldn't really be able to engage with Facebook because of literacy issues. I don't know what the literacy rates are in Senegal. Thanks very much.
Yeah, thank you. So regarding the language, yeah, that was a learning curve, definitely. I have the whole survey also translated into Wolof, and I wanted to implement it, but in the end, we also only used French in our survey because we are using Lime Survey, and the Lime Survey interface does not have the option to have Wolof actually. So in the first pretest, I tried to have both languages displayed at the same time, which did not work very well. We had only a handful of respondents, and I think it was just too much text and too confusing for anyone. So since there was no default option in Lime Survey to have Wolof, we in the end decided to only go with French, which is unfortunate because we had the survey already translated. And regarding the literacy, we don't ask about literacy. We do ask about some information for the network members with which we want to look at how selective in terms of socio-demographics they are. And I was choosing something that the DHS is also asking, though I chose motorbike ownership actually. But I haven't looked at that yet, how much that, I think it, no, I haven't looked at that, how much this corresponds. But sort of what I would, what we were assuming is if people are on Facebook, they have a certain, I would think, maybe I'm wrong, have a certain amount of literacy to be able to engage with the platform because it's not only image based, it's also text based.
No,
More than
that's
maybe
that's what
Instagram.
sorry, yeah, that's what I'm saying. Like your systematic, I mean, the reason that the education is so off is that so many of the people in the lowest category are actually illiterate. And so no amount it would it's hard to know if the I'm just saying the reason for that bias may be related to literacy, and so weighting it based on literacy, if you have that is in the network thing, might be useful.
Yeah.
Thank you very much, Aaron.
Thank you.
So I have some questions myself as well. But let me just. Okay, but before that, let me just look at the questions from participants. Elizabeth asks, great presentation, Jessica. My question is, what kind of quality assessment checks did you have for data collection, both suspicious activity? What worked well, and what was more challenging? Thank you. I just want to add one small thing to Elizabeth's question. You mentioned human versus non-human responses, the rates of human versus non-human responses. So how do you know about that one as well? Can you just let us a bit know about that? And why do you think non-human responses were that high?
Yeah, I looked at this with our IT department because at the beginning we noticed that we were getting a lot of sort of empty clicks. So people just clicks where the recorded start and end time was like 1 second and no filled out surveys. So we were like, what is this? Is this bots or who is this? And we found out that this is like pings or technique checks from Meta. As soon as you enter the Lime survey link as your outbound website where you want traffic to go, Meta starts to check whether this exists. And our IT department had the IP addresses, and we checked those, and it was like owned by Meta. And we found out that those pings don't have in their URL something that's called Facebook Click ID, which I think it's related to the pixel tracking. I think this is what Meta adds if they want to know if they reach the end page. So this is like the tracking pixel. And we noticed that only if it's an actual click and not such a technique check, it has this click ID. So I also collected this click ID, which is for me, it's anonymous information because it's a bunch of numbers that no one outside Meta knows what it's encoding. And then I filtered for this click ID. So if it has this in Lime survey, this field filled out, it was a human that clicked, and if it doesn't, it was the technique checks. And I think in the end, our IT department also set it up in a way that the technic checks don't even go to Lime survey. And another quality check that we had was that we implemented some limitations for who could reach the second survey where they could get the incentive. So only if they actually completed the first survey, they could get to the second one, because we had the fear that people could also just distribute the link to the second survey with the incentives among their sent to other people. So that was not possible. So it was depending on whether you actually entered the first survey and whether you actually spent a few minutes in that survey. So not just a bot that within a second goes through this survey. And this is about all the bots or technical checks that I had. I had the attention check question, as I mentioned. But we didn't use anything like a capture or something at the beginning of the survey, because in our pre-tests we noticed like that it was really hard to also get people to start the survey. So I didn't want to set the boundaries too high and scare off people by making them do some math or something at the beginning. Yeah.
Thank you. Thank you very much for your response. I have another question. So you said that you only limited this to Facebook, and why was that, right? Like you don't have anything to lose using just Instagram as well. Facebook does automatically. So I wonder what was your reason to exclude Instagram users from your audience? And secondly, why did you prefer to use traffic as your advertisement optimization strategy? Is there a specific reason about that apart from its convenience?
Yes, so for Instagram, I checked the audience size estimates with the API before, and there was basically no one in Senegal, so it didn't seem worth doing it. Also considering that you need to make sure that your ads also look appealing then in the Instagram format, and since there didn't seem to be users, I decided to only focus on Facebook. Yeah, and for the traffic part, this was decided together with our data protection officer, who advocated for keeping the survey anonymous and not using the tracking pixel. And that is sort of the institutional policy that we have, that we would rather use the traffic instead of the conversion feature.
Yeah, I understand. I mean, it probably increased prices a bit, the
Yeah,
cost for
probably
you.
did, yeah.
So it looks like it was 200 times more expensive to finish the survey, or a complete response was 200 times more expensive compared to a link click, which shows that, like there's a big difference there, right? If I didn't do the math wrongly. But yeah, if that's the only thing you can do, then you have to go with that. So I have another question. I will take that one. So what is the cost difference between Dakar and other regions, and how concerning is it to have a deviation between the self-reported location and the Facebook-generated location? I was also surprised to see such a large deviation because, as you have said in the academic literature, it is said that Facebook is really good at estimating geography, basically. So in that regard, I am also curious to learn what you think about that.
Yeah, so for the region, I think this is really, really country specific. I also know my colleague Björn Rohr also has a paper with
Student age 47, common issues, Giles, loss of chip volume, and
Aaron, I
Senegal
think you're
holds
not
jury
muted.
statute.
Oh,
Sorry, I'm just muting Aaron now.
I'm very sorry.
No, very sad.
Yeah, so my co-author Björn Rohr also has a paper where he looked at this for a few countries in Africa, and there it also varies, and it's also lower than what you see in Europe. So I think I mean, I don't know Meta. I'm not inside of Meta. I don't know the reason for that. I think that the algorithm is trained on European data and maybe focuses more on where the majority of users are. Could be a reasonable explanation why this is. And yeah, how concerning it is. I mean, gender corresponded fine. I didn't show it, but gender was 90% accurate. For the region, I think it is concerning if you maybe want to specifically do migration research, and this is like the key variable that you need, or if you would also assume that it's lower in countries with a lot of internal migration or seasonal migration. So I think I mean, you probably don't know before you test it. So I would suggest, if this is really key, to run a pre-test and check how much and on what level. Because you also can go to city, you can like different countries have like different yeah, classifications of the regions. Yeah, I think we seem to learn that it varies by country and that you should probably test before. And the difference in the cost, I think it's just a matter of how many users there are. So in Dakar, you have 1,000 more users than you have in some other region in the east, in the middle of the country. So I think just the pool from which the algorithm can choose and can show this ad to, and the amount of data it can generate to learn who to show this to is much higher in the capital than in comparison to other regions. I also saw this when I set up the ad campaign and just wanting to generate 2 age groups, which were already fairly large, told me, oh, there would be no link clicks for this age group. So I think this also explains the cost difference. It's just harder to find people there if there are fewer of them.
Thank you. Just one last final question I have about network reporting, which was very interesting to hear about, and I thought whether that would be used, it could be used in social sciences as well to study more sensitive questions. So I wonder, what is your takeaway from this experiment with network reporting? In your surveys that you will conduct after this research, will you just incorporate that as a usual part, or do you think that you experimented with that and like it is not that practical or not? So what was your own takeaway from this?
I think there's a little bit of uncertainty if you incorporate this, because you need to find a topic that people share, right? So you have to ask people about something that they know about their social network. So we also thought a lot about what this might be, and we thought, okay, children is something that if you talk to people or if you share a meal with them, it's like not a sensitive topic. It's like visible, you might know this. But still, you have to for each of the question in the network part, there was always the option that people could say, I don't know. So I think that's the risk. You ask something and then people just, maybe you have the most committed respondents and great participation rates, but they're just like, I really don't know to the best of my ability. So I think that needs to be tested before. You need to have something that's like shared within a community. And then you need to make sure that your survey is not getting too long, because if you're starting to ask everything for up to 3 people, it easily gets very long. There is like what we asked now with these 3 people. This is like on individual level. We could have also asked on aggregate level. So we could have just asked, in 2024, how many women do you know that had a child? And then we would have received a number. So this is another approach where it's only one question and makes it a little bit shorter, but I think but we chose like the more detailed one. And I think it's something where pre-testing is important to check whether for your question and for your respondents they know. What I did find is that there was not so much dropout for the network part. So if they made it that far, they also responded. for the 3 network contacts. Yeah.
Yeah, interesting. Yeah, I was thinking whether that could be useful in authoritarian settings. But then, as you have said, you need to find questions that people know about other people, and also they are comfortable to share
Yeah.
without feeling like they are spying on them or anything like that.
Yeah, we always had like a disclaimer, like we will not try to find or identify this person, and this is like anonymous and things like that. So I think, yeah, I would assume that people would be hesitant in authoritarian. Yeah, if you're starting to ask online, like people also get suspicious in general, maybe on Facebook surveys.
Yeah,
Yeah.
exactly. Thank you very much. I will now stop the recording.